Welcome back. I'm Mabel, Jong, and you're watching continuing coverage of the World Healthcare Congress here in Washington, D.C. And a very special welcome to the virtual visitors that we have joining us online. In our studio right now, we have Sara Vaezy, who is with Providence St. Joseph Health as Chief Digital Officer based in Seattle. Hi there, Sara.
Hi, nice to meet you.
Well, you're working on a digital health strategy that seems to be very successful. Can you share with us some of the key elements of that strategy?
Sure. So as the head of digital strategy for Providence, we're committed to doing a couple things, and it's easy to say, hard to do. So our strategy as set forth by our Chief Digital Officer, so actually my boss is our Chief Digital Officer, Aaron Martin, is as follows. So first, we create a 10x better digital experience. And when I say 10x better, I mean better, 10 times better online as compared to offline. That's the first step. And the reason we do that is we need to actually get our customers, our patients online with us, to work with us online. And I'll tell you a little bit more about why that's important in a moment. But that's step one. Step two is once we've earned the right to work with folks online through this 10x better, 10 times better experience, we engage with them on an ongoing basis. And we do that through personalized platforms that deliver relevant content, products, and services to them in a way that's meaningful to them. Mm-hmm. And what that gets us is a population that's digitally engaged with us, mm-hmm. and we get a whole bunch of benefits from that, right? We prevent ourselves from getting disintermediated. We are able to deliver much better population health because we are closer to the communities that we serve through digital means, and we can do that really scalably, affordably, efficiently. Mm-hmm.
What are some of key engagement type of strategies that really work with the people you're trying to reach out to, who are increasingly fatigued with messages that they're receiving virtually?
Absolutely. So we've focused first and foremost on women, female head of household who manages about 80 to 90% of healthcare spend. And that's where we've started. So we have built a personalization platform that engages with mom during, expecting moms during her pregnancy, directly after the baby's born, and all the way up through pediatrics, so age 18. That engagement is really important because, and the way we do it is that through, kind of consistently delivering to her via digital means what's important to her. So it prevents that fatigue where you're just getting bombarded with random things. This isn't random. It's actually relevant to you as a person who is managing the health of your family. Mm-hmm. So that's really the way to engage with customers, but you've got to earn the right to do that first. And that's why we first transact with folks online to set up that relationship.
What are some of the questions that you ask people when you do try to find out what sort of messages would work best and resonate with them?
So we actually gather a lot of data, and in addition to asking questions in things like focus groups or user interviews, and we do a lot of user-centered design work. Mm-hmm. We actually collect data on our customers when they engage with us online, mm-hmm. so that we can see the difference between their intent, which is what you get when you ask someone questions, versus the actual behavior that they demonstrate. So we combine questions like, what are your major concerns? What are the biggest pain points that you have in managing the health of your family? What are the biggest points of friction that you have when you're trying to interact or transact with your health system? Those kinds of questions combined with the actual behavior that they demonstrate, that's how we inform what we build.
And the work that you've done has shown that it is successful?
Absolutely. So the first step that I mentioned, the 10x better experience, we've built what we call an e-commerce platform around that. And we have seen tremendous usage of that platform. So we are going to see over 200,000 visits or interactions with our customers, with our patients coming through that platform this year. And over half of those are booked online, for instance. Mm-hmm. So patients are getting used to working with us in that capacity. and they are, and that number is growing year over year. So it was about a fraction of, about half of where it is going to be this year, that last year. So we're seeing folks getting more comfortable with working with us online, and then and using that to interact with us more and more.
And how are you finding the conference this year?
The conference has been very interesting, yeah. So we had I think it's a really great combination of policy discussions that always impact all of us. A lot of interesting perspective from the financing side, a lot of interesting perspective from the health system and provider side. So I think it brings together the right constituencies into one place. It's great.
Sara, thank you so much for your time today.
Thank
really
you.
Appreciate it. And I'm Mabel Jong. Thank you for tuning in. We have one more interview coming up.